Kani kadega Batesi TV, bat pidang pet ya ki kubor baman kasni, balwan rashe pi da ka orange nisan, lom so po niya fabricate shilong.
Hapadang ka jekon ya uknyang jingpang COVID-19, kawai hi na ki jingpta jong ka sarkar ki paiba, kamtam ki tu ki badangwan na ki waipat ki jala ne na shabari. Kalong bakin pentem bat ya tu benya ya kalet kawan jongki syaka GVK Emri 108 emergency service. Da ka ba phone hau number bam don kam mansiu kata 108. Kumba kalong nadu ki kindiat sngi belalai kinong trei ki baran hakan ka kam jong ka 108 kilayo pedang ru shibon ki pajba ki bala phone syaki banya tu ya ki jingsham jongki. Handai nadu ka met kharlai trek mentau bana yayong arjar arpo. Hadin bala bana pajba Halor ka jing ngat jong uwei doktor rangba jong ka Bethany Hospital Shillong hau kunyang jingpang COVID-19 ka jing phone ki breu show number 108 kalanang jor kamtam kitu ki barang dap rong dap mi na Bethany Hospital tang haki kindiat sngi balala ki ba phone show number 108 ban register ilade hakom gane ka por lami rupat sa ka jing thnom na ki ba buon ki pajba namar haba ki phone amjudan pat ki ba shim phone komta ban khamsha shushu Halor kane ka jing thnom ki pajba ka Batesi TV kala yekendo kerpang ro bat kino penya jong ka GVK Emri 108 emergency service.
Buon kibri ki ong banda phone 108 kim yo namar ba ka line ka busy be ki ong bampek ka system jingi ka long kum ni da fi phone kan num long kum ka mobile ba fi yo call waiting okay ka phone kan ring tamba di bam dan ba sim ka mut ba ki barok ha ki dang sim call kum ba fi i menta te shubu menta la da free iway ni kini ki ba ya sim call ta kamon automatically kala pek hi namar ka jongi ke ko auto pick. Okay, think you nginum la but ong ba nginum dan bashim call. They just to clear everyone's doubt. Long ban shu consult ho ya barok ki pat ba ki ba phone she's pa pra ba la da ki phone la da fi snow ba mnan ba pek mndi kumta fi ha ban persang shi persang namar ba mena kini ki ars ni ki labun pala ki nong phone ti sa ki brir ki umta ka mo ni dan ba arpo tam ti man ka second ka phone ka ring bet te long ni ha pek bet ti fin haban shu try bet fin shu yai persang hadu bandi yo long ha ki tu ki por bangim pat bakam padan ka ni ka crisis kum ni ti lada kum ba yi kum tai lada gidan ki call ba ki drop lada ki ayu mo ti gidan ki application ka ba ki pau ki number jong ki ti ni phone biang ki ti ngi yo ti gidan pede ki persang biang ki ong ni lada phone hang ni ya kalong ka
ya bay day menta pade pi dang la ne amban
ya ka ba menta ti long ba kani ka crisis kalong kani ka jinja ka shulong kansan ti ya ka ba menta hi ting nim pat yo ani yala hi ka bele ba bangin phone biang iki kan kidan ki basu ya message no le ni kidan ki ba ya ai na ki para battery lang ne kum ta kan ti kat ki tu ki number bangi yo ni phone hi kat bangila
how chisi try kan no fi call ha por ka ba menta bat ka ba
ani la tam diki hazar
ki normal
la ni ki normal call kan namar hang ni ki dong nang bat ki ba phone ki nong pangru ki beren kam ambulance na benta ki nong pangru ti menta teng ki tu ki badan kam ya ka ambulance ki yo ma beli ki la buon palat ki be phone ti ki dan bede ki bala dan lupa yo tu lan lain number jingi ki phone ha uturu ti ngishim ni register
kila ban share lang to landen
ngila ban share tan ba hang tai ro kan long kum ju hi lada ki busy lada ki bun kam ki tu ki ba ya shim kon kan ring hi kum ju tang ba mndi ban ong ba mdan ba shim na mai kum ngala batai ni nim dan ka tu ka call meeting ka ba ki ong te maka jingi ka ring bet.
This is a centralized call center. Okay, in layman's term, it's a centralized call center which we have, where people can call us. That is dial 108, which is a toll-free number from anywhere in the state. Okay, this is accessible toll-free to any caller, whether from mobile, land phone, etc. So we use this for our day-to-day emergency handling. Where we receive the call from the place of occurrence and then dispatch the nearest ambulance. That is how we work when it comes to the handling of emergencies. Now for this COVID cases, this has been ramped up, okay, and we are operating at the full capacity with 20 stations. That is, at one go we can take 20 calls. Okay, so we operate through something called the PRI lines, so the primary interface lines, which has 30 channels. That is, about 30 calls can land at one go. So because we have 20 decks, that is the maximum capacity through the PRI card and the Nortel system that we handle the calls. The maximum call that we can take at one go is 20. So from the 21st to the 30 call, whatever call lands, there is a ringtone, and yes, of course we can get back, but with the crisis that we are seeing, the call flow and the call traffic has taken a huge surge. Okay, it's like, for example, from yesterday, where it was notified for all people who have visited Bethany Hospital 22nd March onwards are to call and register with us, okay, or with the state disaster response number, that is 1070, or online registration. Okay, those three modes of registrations were announced. So we have seen a surge of call where at one point of time there are 500 calls landing. So that is where the people, because they will, when a person calls, he or she will hear a ringtone. So they will think that, okay, the phone is ringing, no one is picking up. It's not that. It is that all the 20 decks which is there are busy taking calls. So the moment a system is free, the next call in the queue lands there. Okay. So yes, of course, we know the numbers from where the calls have come. We can track those, but with the volume which is running into the hundreds and thousands now, it's difficult to call back everyone.
Okay, in normal day, how many calls?
On a normal day, when we didn't have the pandemic and all, just the normal emergency in the state that we handle, we get about 250 to 300 calls a day. Okay, the capacity for the call center is to handle about 1500 calls a day. Okay, so we can handle up to 1500 calls, and now it's more than that we are handling. Okay, so
now how much?
On an average, now we are seeing that when there is a surge, because see, when we had two surges. One is initial period when it was notified that all people who were coming back to the state, either from abroad or from the different states in the country, they needed to call and register themselves, okay, to notify themselves. So we saw a surge at that point of time, so which was there for about a week or so, and then slowly it decreased. Okay, so it decreased to about that 300 mark, 250, 300 mark, and yesterday again, after notifying for the person visiting Bethany, we have seen, like, for example, in one shift is about 8 hours, we have seen about close to about 1000 calls landing. No, see, it's not possible for us to call all numbers now, because it is a continuous. We have seen from 10 o'clock that we started getting the calls, from 10 o'clock to 8 a.m. That is the night shift ends at 8 a.m., where we have seen there are about 1600 calls landing. So with all decks, busy taking calls, it becomes difficult to call back again. And there are, in this 1600, of course, there are multiple callers also. Like multiple callers means multiple calls from a single caller. Like a caller who has not got once, he tried 2, 3, 4, 5 times. So the same number calling 5, 6 times. Like that also we have. So to filter out all those and then call back, it becomes a difficult challenge. It's a challenge. So because of that, there are multiple options for a person to register. Okay, we have opened, in fact, I have opened up my own personal number, so is the team leaders and all, for all Bethany staff and all who are calling in to register themselves or to travel to Bethany to self-quarantine themselves in Bethany Hospital itself. We are handling those calls also. We are handling those cases also.
Because most of the people, they called.
Yes, they are calling us. We are handling those calls also. But unless it's extreme emergency where a person has to go to the hospital, yes, we are taking them, because there are certain protocols which has been set by the government also regarding hospital admission and all for other emergencies also. So based on that, whatever is coming to us, we are taking those cases also. On an average, like for example, I can say yesterday we have handled about 72 cases. So we have taken and admitted patients or quarantined patient, that is 72 people. Okay, normal emergencies that we have handled, like pregnancy cases, etc. We follow our normal protocols, right? So see, we have 43 locations, right? Now we have 43 locations. with 43 ambulances, right? Out of that, we have picked up based on the different districts, because these are spread all across all districts, okay? Plus we have roped in your state ambulances also, okay, which we have mapped with us. Then we have a dedicated list of ambulances for COVID cases, plus the other ambulances are taking the normal cases. The total, if you talk about GVK Emri staff strength, the total staff strength for Meghalaya is about 250 people, right? That is including the field and the office plus the call center all. Right now, because we are seeing a surge, our call center manpower, we don't have that much, because we don't need beyond 3 people per shift to handle 250 calls a day that we get. So this is a situation which is a crisis situation where there will be a surge and all. So we have been supported by the government, because we have some volunteers who we have already trained. Okay, the civil defense volunteers, then the trainee nurses volunteers. So these people have already been trained into our system, and they are helping us out in receiving the calls, making calls, validating everything, because we are capturing a lot of the fields have to be captured when such cases come to us. Like when we are handling a COVID patient, okay, we go by the ambulance protocol as per the ministry's guidelines. So the PPE is being used, that is being supported by the government of Meghalaya, okay, health department. So the entire PPP is being used by our ambulance staff, okay, plus the suspected cases that we take, they are supposed to wear masks, that is also being provided, okay, plus the disposable of the PPE and all is taking place at the place of admission in the hospitals, plus the ambulances are being sanitized also.
Do we have enough equipment?
Yeah.
To fight?
Yeah. As of now, enough.
Any shortage?
There is no shortage. As of now, there is no shortage. The PPE or any other material, personal protection gear, or the sanitization of the ambulance, etc. Okay. As long as that is there, that is being supported by the health department, government of Meghalaya. Okay. We don't have to buy that. Okay. The only thing that we refill on our own, we have the fund to refill that, so we are refilling. But of course, yes, the running is more now of each ambulance, because there are multiple cases now we are taking. See, as I have just mentioned it is not that we are not taking or receiving calls. We are receiving calls at one go, at one particular this second. Okay, we can take 20 calls. If a 21st call lands, because that option is there, around 30 calls can land at one go. You disconnect, there will be a second call. You disconnect, there will be another call, third call, So total there will be 30 calls at one go that can land. Okay, so we can take 20 calls. The balance 10 calls goes unattended, right? So if you have in a particular period of time huge number of calls coming, we are unable to attend those calls, because that is the capacity of the call center. Now, if you want to expand the call center, it's a different this thing already. But this situation will not be there in the normal course of time. Like when COVID will be over, you will not get that. Yes, of course, but that expansion and all, it depends on what government sees, how the center will be used. Maybe this is a learning curve for us also, how to handle those calls. Yes, of course, but to take more calls, the entire system has to be expanded. So to expand the entire system and entire source, the time is required. Plus, in the lockdown, it's not possible. After the positive case has come out, we are still lucky. We probably is one of the last state to get a positive case, right? I think till yesterday morning I was just seeing, and I was talking with people that it is Sikkim and Meghalaya which is with 0 cases, right? Now the positive case has come, but this is not something that we want to panic about. Right, and the general human behavior is that we get into a panic mode, and that is what we are not supposed to do. Do not panic. This is controllable. This is manageable. The health system or the healthcare health department, they are geared up. We are all geared up to handle this. So it is just about going by the protocols which has been publicized by ministry, by health department, by government of Meghalaya. We need to follow those basic things. As long as we do that, I don't think this can create a issue. And we have to go by. People need to understand. My personal view is like having gone around during the lockdown periods and seeing when the shops are opened and all. We see people coming out as though there is no tomorrow to it. But we need to realize this now. Probably maybe the positive case might help people to realize this. We need to maintain the social distancing. We need to stay back at home, come out only if it is necessary when the lockdowns are relaxed. Okay. And we don't need to go around, because I have seen, because when I used to come to office, I don't go out if I'm not required to, unless I'm called for a meeting and all. But when I come, I have observed this, you have some young boys going around in the locality in car with full music, as though it's the curfew has been lifted. People are buying, they're going around seeing what it is. So people need to realize that the only way to fight this is by isolation. That is how you can break the chain. And the key to arresting this and keeping it at a low figure is by breaking the chain. And that we can do only if we follow the isolation, home protocols, home quarantine protocols, stay as much as possible in the home. For 108 we have 43 vehicles. Okay, but 43 vehicles, as of now all 43 vehicles are not on road. It's a challenge that we are facing, because for us maintenance is the key. So because of the lockdown, we do not have any workshops open. We don't have any workshop support, or neither do we have any spare support, because our spares, most of the spares, it's not available in Shillong also. We have to get it from Guwahati. So that is a challenge for us. Now we have succeeded with the help of government of, because in Guwahati also we have our operation. So through our Guwahati operation and with support from the government of Assam, we have managed to open some of the spare part shops. But again, that inter-district travel is there. So we are trying to get it, try to get these spare parts somehow. Whatever we had in our stock, with that and with our in-house technician and engineer, we have an in-house technician engineer with a service van. We manage it. But we depend on workshops, right? No, there's no role of government managing. Government just releases us the fund, and it is we who follow our schedule. We have a very strict schedule, maintenance guideline and etc., which we need to follow. Okay, and which we follow, plus any preventive maintenance, plus any breakdown maintenance, all that. So in any case, these ambulances are quite old now. At least 30 of the ambulances are quite old, so they need that frequent maintenance and all. Some were in the workshop when the lockdown started, so we could not get them out also. So as I have told you, we have already mapped the state ambulances also. There are certain state ambulances in the PCCACs, right? So we have mapped that. We have mapped certain ambulances who from the NGOs who have supported. They have written state to the government, so we have mapped. But the thing is that we had to train all these people, right? So we had enough time to train. In fact, we have got their training going. We have been into the different districts, training all government drivers or the NGO drivers of ambulances. Now we are looking at how best we can utilize. As of now, for COVID, we have about 62 notified purely dedicated ambulance for COVID, which includes Emri 108 ambulances plus your state ambulances. From our side, from our organization, we already have all those accidental insurance plus other insurance, GMI coverage, all that thing. That facilities are there from the organization right from start. Like if you remember, about a couple of years back when there was an accident, two of our employees passed away, unfortunately, an EMT and a pilot. They have got the full benefit. I think the EMT, because his service duration was longer, he got about 16 lakh or so, the pilot was about 10 lakh or 11 lakh, somewhere there. So they got this insurance benefit. Now with COVID, this is a scheme which has been announced by central government. Okay, so this is to cover all health workers involved in fighting COVID. Okay, to cover them for amount of 50 lakhs. Okay, each person. That is what they have stated. There are of course I have not gone through details of what is covered, how it is covered. The central government, what they have announced is 50 lakh per person. Okay, now we have. In other states we are all covered. Okay, we have moved with wherever we are operating. So the state governments has taken this up and covered. Here also we have communicated and shared our list of employees, the entire employees, okay, to state government to incorporate that, and that is being done. So here also it will be covered. It is 50 lakh coverage for COVID. There is a special coverage package which has been announced by Prime Minister.